So let's jump into ketamine and how ketamine has become, relatively popular over the last just few years. Again, from show of hands, and especially jumping all the way back to 2007, but really just jumping back to 2015 and 16, I can tell you without any doubt that the number of people who are raising their hands is just phenomenal compared to just a few years ago. And why has ketamine become so popular? Well, one, there's this whole anti-opioid thing going on where everyone's like opioids are useless and we need to look at literally everything else. That's one. But the other is, people are starting to recognize how ketamine can be useful for centrally mediated disorders. And when used properly, they can be quite useful and the results can be quite dramatic when used properly. And believe it or not, the side effect profile can be quite low when used properly. But of course, the key line there, when used properly. When they're not used properly, of course, we can have abuse, we can have misuse, we can have side effects, all of those different things. So ketamine was first synthesized in 1962 by a gentleman named Calvin Stevens, who was out of Wayne State University in Detroit, and was first tested on humans back in 1964. So it's been around for quite a while, really quite a while. It was FDA approved in 1970. So it was really FDA approved before even some NSAIDs were FDA approved. Ketamine is a core medicine by the World Health Organization's essential drug list, a list of minimum medical needs for a basic healthcare system. So what that means is the World Health Organization has already deemed this as, listen, if you're going to have a basic, sort of trauma unit, okay, a basic medical unit, ketamine should be on the list of emergency drugs that you need. And why is that? Because again, in the battlefield, ketamine is used quite widely because of its unique properties of not causing respiratory depression and not reducing the cardiovascular system, which we'll again talk about in a little bit. Oops. Properties of ketamine: it is a highly lipophilic molecule. It has a racemic mixture of the S and the R stereoisomers. As you guys know, there was a recent FDA approval for S-ketamine, which is the S isomer of ketamine, which was approved for depression, which has been really, really great for a lot of us because, again, it sort of proves what we already knew for a long time, which is depression is a centrally mediated disorder, and NMDA is quite an important receptor when it comes to depression. So if we can reverse that NMDA receptor pathology, we may be actually able to reverse the depression. Depression is not inherently a serotonergic problem. It's actually an NMDA receptor problem. Serotonin is just one of the downstream molecules that is involved in depression, but NMDA really ends up being the primary source of the pathology. Rapid onset IV, it's about 30 seconds. IM is 3 to 4 minutes. Duration IV, it's about 5 to 15 minutes. IM about 12 to 25 minutes. Half-life is relatively short, only about 2.5 hours, and distribution half-life is about 11 to 16 hours. Metabolism is hepatic, with norketamine as 33% as potent as a parent compound, so it does have an active metabolite, not as potent obviously, but does, and excreted in the urine.